Been a worrying spike in malaria cases in Limpopo. Sadly, 2 people have died. Over 1,400 cases have been reported. The health department, as you'd expect, urging everyone to take preventative measures, be very careful, of course, and safeguard themselves. Let's get some details. Limpopo Health MEC, Dr. Phophi Ramathuba, joining us this morning. Dr. Ramathuba, good morning to you. We'll talk about what communities need to do, how clinics are coping in just a moment, and the little ones, the kids, we'll talk about in a second. First of all, what's led to the spike? What's your understanding? Good morning.
Morning, Gareth, and morning to all your viewers out there, and thank you for inviting us. Usually around March, February, we experience a spike in terms of malaria cases. That's when they peak. However, this financial year, we passed March and almost past April. It started towards the end of April, around the week of the 24th, when we started to notice more cases presenting at our clinics. I think what could have resulted, it's that firstly mosquitoes thrive in a rainy season and also in a warm temperature. So if you look at this year, even currently now in May, we're still experiencing rain, abundance of rain, especially in those eastern part of Wembe and the Lowveld and Mupani, a part of Mupani. It's very hot. You know, today in the morning it starts being very cold, rainy, and again it becomes very hot. So that is why you probably are seeing the spike and the surge around this area. The second reason could be if you look around the SADC region, all those countries that has been historically malaria endemic, they are also experiencing a surge. If you look at provinces, parts of KZN in the country and also Mpumalanga, we also experiencing an increase in the number of cases. We also looking at the patterns to say after Easter holidays, when most of our migrant workers and also some from the farming areas, when you travel from home to come back, if you could be carrying the parasite, if when you were visiting home during that season and you were bitten by a mosquito that is carrying this parasite, it then leaves the parasite in your system. Unfortunately, when you arrive in those particular areas which are malaria endemic in our province, you then, if you get bitten by a mosquito, it takes, if it's an Anopheles 1, the female, it takes that parasite to the entire family that you are with, because it can bite up to 10 people.
So there's the issue as well, the travelling as well, Doctor. But talk to me, if you could, while we understand now how it's being transmitted. Travel is a big issue, weather's a big issue, the region we're talking about is a big issue as well. Are there particular age groups of concern as well? Are we worrying especially about the very young and the very old, or is this spread across all the age demographics?
And unfortunately, it's spreading across all the age groupings, but we have not seen the young children below the age of 5. We are seeing those who are active. I mean, the children of 10 to 15 years who at night they are playing outside and they get bitten by these mosquitoes. And we are also seeing mostly the adults, the ones that are working, whom I have already indicated what could have been the cause, being the ones who might have been carrying these parasites from one area to another, and then find the mosquitoes there and then spread it. The other thing that we've noticed is that unlike when you have an outbreak that would be clustered within a certain area. You know, when we try to do tracing of these cases, you will find that there's a case in one village and you jump 2 villages and you've got another case. So it could be 2 cases can be 10 kilometers apart between 5 to 10 kilometers apart. So that tells you that this is probably not necessarily the outbreak that we would be used to, but how we are now trying to interrupt so that it doesn't spread across, because we had already done the indoor residual spraying since last year. Our season starts around September, August. The chemicals that we use, the KO3 and the DDT. KO3 will last you for between around 6, sometimes 7 months if you are lucky. But the DDT is the one that will last longer, up to 10 to 12 months. Now, those households that we have sprayed at the beginning around September, August with KO3, the chemical has already weighed off. So that is why now we are using what we call the focal indoor residual spraying, targeting where a case is being recorded. We will go to that particular village and try to then redo the indoor residual
just to ensure that the
spraying.
efficacy of the chemicals you're spraying are staying in place. Well, I see some of the pictures online, Doctor. We're seeing people going in and spraying the various households. Needs to be redone. So that's one way of assisting and preventing. As I say goodbye to you, Doctor, very briefly, it always seems like an obvious question. Let's just remind people, though, malaria is easily treatable. How are the clinics coping in the area? And what are the concerns for parents? What are the symptoms people need to look out for? Very briefly, Doctor.
You're quite right. Malaria can be prevented. I've already indicated you can also prevent it yourself by making sure that you use mosquito coils, the ointment. When visiting the malaria endemic area, you can take prophylaxis. Secondly, malaria can be treated. All our clinics, especially in those areas, we have made sure that they've got test kits. They also are equipped with the tablets. Any patient, if you feel you've got a headache, you've got fever, sometimes it's chilly, your body's shaking, some people even go through vomiting, others might even have diarrhea. So all those, it could be a flu-like symptoms, it could be a mimic your COVID-19. Unfortunately, our people would run to the chemist to buy Panado or drink Med Lemon thinking it's flu. The reality is that if we don't interrupt malaria since the onset of symptoms, within 24 hours, it can complicate and we can lose you. Now, lastly, when you visit a malaria endemic area and you come back after 7 days, you start experiencing these symptoms. When you visit your practitioner, especially if you come from cities, metros where they are not known to be malaria, please be clear and be specific that I had visited Kruger National Park. Because if you don't do that, your physician will spend time testing COVID, testing meningitis, doing all sorts of tests until such time when he thinks of malaria, it might have been too late. So let's assist each other. Let's take our responsibility, because our health remains our responsibility. And then malaria can kill finally if we don't do what we have been advised to do. It can be prevented, it can be treated, but it can also kill.
Yeah, it certainly can, and it's an unnecessary way for someone to lose their life, Doctor, because it is so easily preventable and easily treatable. Dr. Ramathuba, I thank you for your time. Dr. Phophi Ramathuba.